The Affordable Care Act, often referred to as Obamacare, is a landmark healthcare reform law passed in the United States in 2010. It was designed to improve the quality, accessibility, and affordability of health insurance, aiming to reduce the number of uninsured Americans and improve the overall healthcare system. The ACA established health insurance marketplaces, also known as exchanges, where individuals and families can shop for and purchase health insurance plans. These marketplaces are available at the federal level through HealthCare.gov, and at the state level, with many states running their own exchanges. The goal was to make it easier for people to compare health plans and select the one that best fits their needs. The ACA aimed to expand Medicaid eligibility to more low-income individuals. Medicaid Expansion allows more people to qualify for free or low-cost health coverage. However, not all states adopted Medicaid Expansion. Some states, especially those with more conservative political leadership, opted out of this expansion. The ACA originally included a requirement for most Americans to have health insurance or pay a penalty. This individual mandate was intended to encourage healthy people to buy insurance, which would help keep costs lower for everyone. However, in 2017, the Tax Cuts and Jobs Act effectively eliminated the penalty for not having insurance, though the individual mandate is still in place in some states that have enacted their own laws. The ACA introduced several critical protections for people with health conditions. No pre-existing condition exclusions. Insurers can't deny coverage or charge higher premiums to people based on pre-existing health conditions. Essential health benefits. Insurance plans are required to cover a set of essential health benefits, including maternity care, mental health services, prescription drugs, emergency services, and more. Ban on lifetime and annual coverage limits. Insurance companies can no longer place limits on how much they will pay out over the course of a person's lifetime or in a single year. For individuals with low to moderate incomes, the ACA provides subsidies to help reduce the cost of health insurance premiums. Cost-sharing reductions, or CSRs, are available for lower-income individuals and families to reduce the out-of-pocket costs of healthcare, such as deductibles and copayments. The ACA also included a mandate for larger employers with 50 or more full-time employees to provide affordable health insurance to their workers or face penalties. One of the most popular provisions was allowing young adults up to age 26 to stay on their parents' health insurance plans. This helped many individuals who were transitioning from school to work and didn't have access to employer-sponsored insurance. The ACA also included provisions to improve Medicare, such as closing the Medicare Part D donut hole, a coverage gap in prescription drug benefits, and providing free preventive services to Medicare recipients. Do you need ACA healthcare? Whether or not you need ACA healthcare depends on your individual circumstances. Here's why it might be important. The ACA is especially valuable if you need health insurance and want to ensure that you have access to essential services like hospital care, prescriptions, mental health services, and preventive care. If you are uninsured or underinsured, ACA healthcare provides a means of obtaining comprehensive coverage, often at a lower cost than other alternatives. For people with low to moderate incomes, the ACA offers financial help in the form of subsidies that can significantly reduce the monthly premium costs. These subsidies are based on your income and household size, and they make health insurance affordable for many individuals and families. Some states have also expanded Medicaid, meaning that people with incomes below a certain threshold can receive Medicaid benefits, which is often free or very low-cost health coverage. Health insurance through the ACA can help protect against high medical costs, particularly in case of serious illnesses or accidents. Without insurance, medical bills can quickly add up and create significant financial hardship. ACA plans have out-of-pocket maximums, which limit how much you have to pay for covered services in a given year. Once you reach this limit, the insurance covers 100% of the costs. If you have a pre-existing condition, such as diabetes, cancer, or heart disease, the ACA ensures that you can get health insurance at no additional cost or penalty. Prior to the ACA, many insurance companies could deny coverage or charge higher premiums for people with these conditions. ACA-compliant plans cover a wide range of preventive services at no additional cost to the insured. This includes things like screenings for cancer, diabetes, vaccinations, and other preventive care that helps catch health issues early and manage chronic conditions effectively. Do you really need health insurance? While health insurance, particularly ACA healthcare, provides significant benefits, there are situations where someone might choose not to enroll. If you're young, healthy, and don't anticipate needing many health services, you might not feel the immediate need for insurance. However, even in this case, health emergencies can happen unexpectedly, and without insurance, the financial burden could be overwhelming. Other coverage options. Some people may have access to insurance through their employer or through a government program like Medicaid or Medicare. In these cases, the ACA might not be necessary. Costs. While the ACA makes health insurance more affordable for many, it's still possible that premiums, even with subsidies, could be too expensive for some people. In such cases, the decision to go without insurance may seem more appealing, though it is risky in the long term. The ACA healthcare system is vital for ensuring that Americans have access to affordable and comprehensive health insurance. Whether you need it or not depends on your individual healthcare needs, financial situation, and whether you have other options for insurance coverage. While the ACA has made health insurance more accessible, it's essential to evaluate your specific needs and circumstances to determine the best course of action for yourself and your family. Would you like to know more about how to access ACA health insurance or its specific benefits?